Hi, this is Anu, and you're watching Anu for Nurses. We are moving on to the last sessions of endocrinology. That's mainly what's remaining is the pancreas and its disease condition. And one more pediatric condition is pending, but the major one is this. And I hope you remember in the initial classes we were discussing about the cells of pancreas and the hormones and all. When you consider the pancreas, it actually has the endocrine and the exocrine function. The exocrine function is mainly associated with its enzymes, the digestion, and when the inflammation of the pancreas or pancreatitis occurs, there will be all problems related to this pancreatitis and digestive issues. That's a different thing. Here we are discussing only about the endocrine function of pancreas. So for that you need to be remembering the cells of pancreas, mainly alpha, beta, delta cells. And alpha cells producing glucagon, beta insulin, and your delta cells somatostatin. This actually regulates the other hormones of pancreas, this somatostatin. And there is another somatostatin that is related to your, which one? I hope you remember, that is the hypothalamus. That's a different thing. So here islets of Langerhans is another term you should be remembering. That's the specialized cells capable of producing this insulin, or these beta cells are contained in this. And this cell's name also has come for your examination many times. And one time the question was like, where is this islets of Langerhans mainly concentrated in? And the answer was tail of pancreas. So when we discuss about this pancreas and its hormones, the major thing to be discussed is the glucose and glycogen. And you know, the glucose, when there is too much of glucose in your blood, it's a hyperglycemia we say, and our cells will be requiring this fuel or this glucose for the metabolic functions and all. So what happens is the insulin is actually mediating the movement of this glucose from the blood to the cells. When there is insufficient insulin, this glucose transport is very difficult, and the remaining glucose will be stored as glycogen in the liver. So when the blood sugar levels are low, what happens is this glycogen will be converted back into the glucose. You can use it up, your cells can use it up. So that is done by your glucagon, glycogen to glucose. But glucose to glycogen, for that you need insulin. So that is the main thing to be remembered. So when there is too much of glucagon is actually released when there is hypoglycemia, and insulin is required to move the glucose from the blood. Now, what is this diseases associated with? It's mainly diabetes mellitus. Everybody knows that. And two types mainly we can say, that's a type 1 and type 2 diabetes mellitus. And this gestational diabetes mellitus, or GDM, is mainly the type 2 diabetes. And what is type 1? It is insulin dependent diabetes mellitus, because the main problem here is not sufficient insulin. But type 2 is insulin is there, but your tissues are resistant to insulin, so cannot take up. So that's the problem. And type 2 diabetes can be improved by exercise and lifestyle modification. But for type 1 diabetes, you need lifelong replacement with insulin. So that is what you should be basically knowing. So you can say that insulin dependent means can't make insulin, or insufficient insulin versus tissue resistant to insulin. These are the two problems that can happen in diabetes mellitus. Then, why this is happening? We know in type 1 mainly we can say it can be genetic or autoimmune related to some virus, or it can be lifestyle related, means it's mainly type 2. What kind of lifestyle? Obese patients, or too much of stress, sedentary life, all those things can be the main reason, or the diet pattern for the type 2 diabetes mellitus. When we discuss about all these, one important thing we need to, or for the questions it can come, is the metabolic syndrome. What is metabolic syndrome? Metabolic syndrome means a group of conditions that can actually place the patient at risk for heart disease, stroke, or other major health issues. So, who are at risk for this metabolic syndrome? Those who are having a high waistline, that means abdominal obesity and all we say, and then the triglycerides levels are too high. Not just the diabetes, along with that, if the triglycerides are very high, they are at risk for atherosclerosis and other heart diseases. Plus, very high LDL and low HDL. You know, HDL is a good cholesterol. When its level is too low and LDL is very high, they are more at risk. And high BP, high blood sugar level. These patients are at risk for developing metabolic syndrome. Keep this in mind and note it down. Then, what are the features of diabetes mellitus? You know, like a song, it has been studied, right? Polyuria, polydipsia, polyphagia. So there will be lot of urination because it's like concentrated with sugar. When too much of sugar is there, there is a tendency, right? Polyuria. Because of that, there can be dehydration causing polydipsia. Thirst will be there, and polyphagia. They will feel like eating more. And type 1 diabetes, you can see weight loss, and type 2, they will be a little obese. And because of this sugar in the urine, they can develop urinary tract infections, and these yeast love this sugar. So what happens is vaginal candidiasis is very common, and wound healing will be very slow. It can also affect vision. So these are the important features to be remembered about diabetes. Now, what are the complications? You know, when we discuss about the complication, it can be divided into microvascular and macrovascular complication mainly. Along with that, apart from this, many other things need to be learned like Somogyi phenomenon, Down phenomenon, diabetic ketoacidosis, and HHNS and all that we will discuss later. The major complications what we can study first classify it into micro and macrovascular. Microvascular means minute vessels that's affecting and leading to complications like retinopathy, nephropathy, neuropathy. And the macrovascular are the major vessels that's been affected, that is leading to stroke, heart diseases, or arterial insufficiency. So this micro and macrovascular complications are also very important for your exams. We will be continuing with many more things to study about diabetes like insulin types, all those and all will be discussed in the next videos. Till then, keep learning, stay blessed and healthy. Bye.